Hello and welcome to this short webinar on how to get rid of an anal fissure and get rid of it permanently so that it doesn't come back. Okay, so welcome to the webinar, and I'm just having a look now and see people still joining us. So I'll tell you a little bit about me. My name is Joe Johnson and I've been treating people with natural remedies for over 25 years. I'll say now, later on I'll spend 2 minutes just telling you about this anal fissure remedy. So I'll tell you about that later on. But let's get on with it now. Plenty of people have joined us. What is an anal fissure? So imagine that is your anus. That there is your anus. And a fissure is when, see, your anus opens and closes as you're passing a stool, as you go into the toilet. It opens and then closes. It's a ring of muscle. And sometimes a crack appears on that ring and it is extremely painful. That is called a fissure, an anal crack or an anal fissure. So first of all, what causes it? There could be a number of ordinary things that cause it. It could be that you've been constipated and you've been straining too hard, and it actually tears the ring of muscle. It splits it, and you only need a millimetre or 1/8 of an inch long, a tiny little split, and then it starts to just split worse and worse and worse, and it can go from 1 millimetre to 10 millimetres or up to ½ an inch long in no time at all, and it can be excruciating pain. So you could be constipated, but by the same token, people who have had long-term diarrhea, that can also cause a split to appear on the skin. Remember, it's a ring of strong muscle, but it's only protected by a delicate layer of skin. And that's important, and I'm going to come back to that. It's the skin. Okay, so it's constipation, it could be diarrhea, or it could be that you've eaten a certain food and you've had a particularly large stool. You've passed a big one, and that is enough to split the skin ever so slightly. And once that split has started, then it gets infected, then the misery starts. Another common cause is it could be childbirth. Women giving birth to children. You can all kinds of stresses and strains and pushing, and it splits the skin. And then again, you know, the childbirth, after the child's been born, then you've got a torn anal sphincter. You've got a crack there that needs treatment. Another cause could be anal intercourse, where people have had intercourse and they've managed to just split the skin a little bit, and then, as I say, that little tiny crack starts to split more and more. It gets infected, it gets bigger, and it's a misery. So they're the common causes of an anal fissure. So how do you treat it? Well, first of all, you could go to the doctors, and the doctor will have a look at it, and very often they will recommend, apart from cleaning, the normal cleaning hygiene, which you can do, obviously wash it on a regular basis several times a day, but the doctor just normally recommends a cream. Now, the most common cream that they'll recommend is actually nitroglycerine. You know, in the old days when people had angina, pains in the heart, the chest, they used to give them nitroglycerine pills. So you'd pop a pill and it immediately relaxes the blood vessels, takes the pressure off the heart. So they've realised that if you use nitroglycerine cream, apply it to the fissure around the blood vessels around the split, it relaxes and relieves the pain. But that's it. It's just temporary relief. The only other real treatment that a doctor could recommend to you is surgery. Surgery. Now, obviously, that's drastic, and if you can avoid surgery at all costs, I would avoid it, because, well, it's pretty obvious. Explore other avenues of treatment. Now, fortunately, I'm going to share with you now how to treat the fissure yourself. Okay, now, first of all, getting instant relief. There are creams in the drugstore and the chemist that you can just smear, just ask for an anaesthetic cream. You can put it on, it'll give you instant relief, but it will do nothing to cure or get rid of the fissure. Okay, so that's how you can get instant relief. Other people recommend having baths, hot baths, and you can put salts, like Epsom salts, or you can put salts in the water and it'll help to provide some kind of relief. It'll do nothing to get rid of it. So, how do you get rid of it? Well, before I tell you, I want to tell you now why the thing split in the first place. Because apart from childbirth and maybe anal intercourse, the other things like diarrhea, constipation, you've had these things regularly as you go through life. So it isn't normal for that skin to split. So why did it split? And I'll tell you. Your whole body, even a healthy person, you haven't had an anal fissure all your life. You've been healthy most of your life. You've been covered in bacteria, viruses, yeast, molds and fungus. You are covered in it all the time. And your immune system stops you from getting eaten alive. So I'll say that again. All of us, every living thing in nature is covered in tiny little creatures that are just looking for somewhere to live. Something to eat, somewhere safe. Now, your backside, your anus, it's warm, it's dark, it's damp, there's plenty of food. So it starts to eat the skin. It weakens the skin. Now, if you then strain that skin, it will split. I'll say that again. So you've got fungus. For some reason, your immune system hasn't defended. It hasn't done its job, and you've got fungus eating the skin. You've strained the anus, and you've split the skin. So what you've got to do is this. You've got to do three things. Two things essentially. One, you've got to kill off that fungus. You've got to then kill off any bacteria, because once you've split that skin, bacteria can get in. Remember, your immune system isn't working as effectively as it should. So fungus causes it to split, bacteria gets into the fissure, and then it starts to get really infected. And it is extremely painful, as you already know. So you've got to kill off the fungus, kill off the bacteria, and then promote healing. You've got to get the thing to heal up, right? So how do you do that? First of all, the remedy. Now, I've been working with natural remedy for 25 years, so I know what kills off fungus and I know what kills off bacteria. So in here are 4 very powerful plant extracts. There's clary sage. Now write this down, you can make this yourself. There's organic clary sage essential oil. It's very powerful and it will kill off the germs in your anal fissure. Then there's frankincense, organic frankincense. That will kill off the bacteria and it'll also kill off the fungus. Okay? Then there is geranium, organic geranium. Believe me, these are very powerful antibiotic and antifungal plant extracts. And then the last one, myrrh oil. You know, the Roman soldiers, when they were in battle, 2,000 years ago, they invaded the whole of Europe and North Africa. These soldiers, they were sent out into battle with a sword and a shield and a helmet and everything. But part of their kit, it was a part of their kit that they had to carry a bag of myrrh resin. It's a resin. It's a plant extract resin that if they got injured in battle, they got infected, apart from being in agony and useless as a soldier, they would die of infection. So they got myrrh oil and myrrh resin and forced it into the fissure, the wound, the sword wound. Why did they use myrrh oil? Because it killed off the infection and it saved the soldier's life. Okay, so I've put myrrh oil in this. It'll rapidly kill off any infection and it will promote healing of the wound. Because It's easy to kill off bacteria and fungus, but you've got to get the thing to heal up again. So, these 4 oils, clary sage, frankincense, geranium and myrrh. Okay? And they're all organic, and they're mixed together, and I've mixed it then with sweet almond oil to just dilute it down slightly, because you don't want to burn the skin on your backside. So that's what's in here. In fact, that's only half of what's in here. So you can make it yourself, or you can, if you want it from us, we can send it out to you today, urgently, in a discreet packaging, so that you can start applying it to your backside. But that's only half the battle. Remember what the cause of this is. How come you've got an infection on your backside? Because your immune system's job is to defend you, and it obviously hasn't done it. Why did that fungus weaken your skin? Many people with anal fissures tend to suffer from maybe sinus infections or yeast infections, occasionally yeast infection, and they certainly can feel run down and exhausted and tired. Now they're all symptoms of a weak immune system. So, with this remedy, what we've then done is to put 4 homeopathic remedies blended in this oil. So you've got the plant extracts to kill off the bacteria, to kill off the fungus and promote healing. And then we've got 4 specific homeopathic remedies dissolved into this. So it's very simple. It's a simple oil. You just massage it onto your backside at least 3 times a day. So you get up, have a wash, towel dry, and then massage it on. Just gently rub it on and leave it. Do that at least 3 times a day, but definitely at bedtime again. Just put a couple of drops on. It will provide a sort of anaesthetic property. It'll reduce the pain instantly. But more importantly, the bigger job is to, 1, get the healing to take place, and then boost your immune system so that no fungus can then weaken your skin again, and you won't get an anal fissure again. And it's that simple. So I'm just seeing now there's some questions coming in, and I just want to see what people are saying. Will my fissure ever go away? Well, you could have months of agony. And not only that, if your immune system is weak and you're in agony, if your immune system's weak, you could again start getting other things wrong with you. Cold, flu, sinus infection, yeast infection. So I would say don't wait for it to go away, get it treated. Okay, another question here. What is the best treatment? As I say, you can go to the doctors and they will give you relief cream, which is the nitroglycerin cream, or they will offer surgery. But once you start, remember, if you cut into that skin, into the muscle behind it, they cut into your body and then they sew it up again. But they haven't touched your immune system. In fact, they've made it worse. When you start cutting into somebody else's body, you're harming it. So the surgery is treatment of last resort. Remember what we want to do. We want to boost your immune system. It's easy enough to get rid of an anal fissure. You want it to get healed as quickly as possible, but you want to boost your immune system so that you don't get another fissure in a month or 2. Okay. So don't wait for it to go away. Are anal fissures dangerous? Well, it's not dangerous on its own, but the fact that you've got an infection, the infection can get worse. I've known one case of it where literally it spread out from the anus and it got severely infected all around the backside. It all went literally red and swollen, and I urge the person to get straight to the doctors. So don't leave it untreated. So yes, it can get worse, but as I say, you're going to treat that today. You're going to treat that today, and you're going to stimulate your immune system so that this doesn't happen again. Is coconut oil, will that heal the fissure? Well, that's a good question. Coconut oil. If you look in the shops, you'll never see a mouldy coconut, because there's a very powerful antifungal in coconuts. Coconuts don't go mouldy. So if you get coconut oil and you smear it on your backside, it'll provide you with some relief. Alright, it'll provide you with a bit of relief. So, yeah, but it's no good in the long term for treating an anal fissure. What else have we got? Is Vaseline good? Again, Vaseline, it'll provide you with relief, but it isn't going to treat it. So your anal fissure, I don't know how long you've had it, you might have had it a week or a month, it's acute pain, but you don't want it to become a chronic condition, and it can be. There are people out there who've been using nitroglycerine, they've been avoiding surgery, they didn't know about what this remedy, and it's turned your life into a misery because it becomes chronic. Yeah? And you don't need that. You can cure the fissure and then focus on your immune system, and you won't have an anal fissure again because the skin around your backside will become strong like it should be. And I'm going to show you how to prevent an anal fissure from ever coming back. Aloe vera, again, somebody said, is aloe vera any good? Yeah, again, put it on, instant relief. If you've got some aloe vera at home in a jar, put it on, and you think, oh, thank God, that feels great. But it doesn't promote healing of the fissure. It will provide you some relief. If you've got aloe vera, got it, apply it. So, can spicy food cause fissures? No, it can't cause the fissure. But what spicy foods can do, especially stuff, imagine chili seeds or something really spicy, they don't get properly digested, it passes through, and then as this spicy food comes into contact with your anal fissure, it can make you scream. So avoid spicy foods until it's healed up. And it won't take long, but avoid spicy foods if you've got an anal fissure. Somebody's asking here, what's the difference between piles and an anal fissure? Right, an anal fissure is a crack here, and the crack is caused by weak skin. The skin has been weakened almost certainly by fungus. If it wasn't weakened by trauma, i.e. anal sex or childbirth, it's been weakened by fungus. So what we're going to do is kill the fungus, we're going to kill the bacteria that's in the actual infection, we're going to kill that back, and then we're going to promote healing so it heals up. And then we're going to make sure that you don't get any more fungus back again, okay? Now, so that's what an anal fissure is. Piles or hemorrhoids. So you sat on the toilet and you're a bit constipated. Now remember, around the anus there's a blood supply. Tiny blood vessels keep it all as it should be. But as you physically push, the pressure in the blood vessel can go, the wall of the blood vessel can open. Tiny little crack in your blood vessel, and it can release blood like a balloon. Imagine it like a tiny balloon. So the blood has gone beyond the boundaries of the blood vessel, and it's like a balloon then. And then that balloon can be pressing on nerves, and it can be extremely painful, okay? Extremely painful. That's hemorrhoids, that's a separate issue.